Assalamu alaikum. Today our topic of discussion is the control of cardiac activity, cardiac output, and the peripheral circulation. First of all, we must know that what is cardiac output. Actually, this is the total amount of the blood pumped by your heart into the aorta in each minute. You can say that or total quantity of the blood flowing through the circulation. Definitely total quantity of blood comes from the heart through aorta. So cardiac output is the total quantity of blood pumped into the aorta per minute by the heart. Cardiac output is one of the most important factor of the circulation, or in other words, you can also say that cardiac output is the sum of blood flow to all the tissues of the body. Sum of blood flow or systemic circulation is always equal. Next is the venous return. It is the amount of blood return back right to the right atrium in each minute. After providing oxygen to each and every cells of the body, the blood returns from the systemic circulation into the right atrium. Right atrium always receives deoxygenated blood. Per minute, receiving of deoxygenated blood from the body from the body to the right atrium is known as venous return. Venous return is always equal to the cardiac output. Why these are equal? Because a heart pumps blood into the body, and definitely this blood circulates in whole body and then returns to the heart. So cardiac output is always equal to the venous return. But there is few exception of actually exception of few seconds. uh, this is the time when this is the time of actually filling heart with the blood. At that time cardiac output and the venous return is not equal. Filling of the blood or the removal of the blood from the heart and the lungs, at that time venous return is not equal to the cardiac output, and this is hardly few seconds. Next is the normal values of cardiac output at rest and during activity. Okay, cardiac output depends on the various factors in the body. These are the body metabolism. If body metabolism is high, there is more utilization of oxygen in cells of the animal. When the utilization is more, cardiac output is more, or the pumping of the blood toward the tissues and cells is more. And definitely it is done by the heart pumps blood to systemic circulation. Okay, next is the age. At the small children have a higher metabolism. At less age, cardiac output is more because cells are growing or development occur in the body, and the oxygen need of oxygen is more, so heart pumps blood toward the cells. While when in the older ages, um, muscles of left ventricle gets thickened, and to some extent the size of the heart increases. And this stiffness in the muscles actually causes actually it causes difficulty in the blood flow, and cardiac output decreases with the age. Size of the body, if the size is more cells are present in the body, there is more need of oxygen. Exercises during the strenuous activity, uh, actually consumption of oxygen is more in the body. So during the exercises, during exercises cardiac output increases to meet the need of uh, cells. Resting cardiac output of an average man is 5.6 liter per minute, and the woman is 4.9 liter per minute. When we consider different factors in animal, or you can say that in a human adult, just like their body activity, their increasing age, and a mass of some tissues diminishes the cardiac output, normally round about 5 liter per minute in every adult individual, or you can say this is the average of the cardiac output in adult human. Now, what is the cardiac index? Cardiac output per square meter surface area of the body. Cardiac index is actually an assessment of the cardiac output value based on the patient size. If the size is the more, then the cardiac output is more. The different experiments were done, and from these experiments, it was evident. Yeah, we obtained that cardiac output increases as the surface area of the body increases. For example, if a normal human being with a weight of 70 kilogram has a body surface area of 1.7 square meter, which means that their normal cardiac index is 3 liter per minute per meter square. Effect of age on cardiac output. This is a graph showing the effect of age on cardiac output. Here you can see that, okay, now this graph is clear. At x-axis we take age in years, at y-axis we take cardiac index liter per minute per meter square. Okay, you can see that at the age of 10, the cardiac index is, or cardiac output is maximum. It's round about the 4 at the age of 10. This is a maximum. While with the increasing age, you can see that cardiac output is decreasing, or the curve moves downward. At x-axis, we take age. This and y-axis, at y-axis we take the cardiac index. Cardiac index actually depends on the age, और यू कैन से दैट मतलब हम वाई एक्सिस पे वो वेरिएबल रहते हैं जिसको हम जांच रहे होते हैं या एग्जामिन कर रहे होते हैं. कंट्रोल ऑफ कार्डियक आउटपुट बाय द वेनस रिटर्न. रोल ऑफ फ्रैंक स्टार्लिंग mechanism of the heart. Cardiac output is controlled by the venous return. Cardiac output is the amount of the blood pumped by the heart into the aorta per minute, and this is not controlled by the heart itself, it's controlled by the venous return. Various factors of peripheral circulation. Various factors of peripheral circulation are the primary controllers. Human heart has normally built-in mechanism of the contraction that allow it to contract rhythmically, with the passage of rhythmically, because heart has the sinoatrial node, and sinoatrial node, the walls of sinoatrial node are naturally leaky to the sodium ion, so action potential generates in the sinoatrial node, and then it is transferred to then it is transferred over whole heart, because atrial fibers are attached with the no fibers of the sinoatrial node, and then the fibers of the sinoatrial node are no sorry then the fibers of the atrial tissue are attached with the ventricle. So in this way, action potential or nerve impulse travels on the surface of the heart, and it causes the contraction. Frank Starling mechanism of the heart. When the blood quantity of the blood enters into the heart from the systemic circulation, actually this is the venous return. When the heart chambers are filled with the blood. Blood exerts a force against the walls of the heart. Chambers contract. Now the chambers contract with the more force because they are filled with the blood, and this sympathize the extra blood that enters from the systemic circulation. Second factor is that heart causes stretching of heart causes uh, the pumping of heart fast. Stretching of sinoatrial node, it has direct effect on the rhythmicity of the heart. If it is more stretched, it causes more action potential, and even its stretching causes the heart rate and the increase in the heart rate approximately 10 to 15%. In addition, stretch in the right atrium initiate a nervous reflex known as brain bridge reflex. This increases heart rate due to venous pressure. It activates the vasomotor center. Vasomotor center is an area of the medulla oblongata that regulates the blood pressure. Then it activates the sympathetic nerves and the vagus, and the heart is activated. There is more contraction of the heart, or you can say the heart rate is increased. Next topic is the cardiac output regulation is the sum of blood flow regulation in all the local tissues of the blood. Definitely, this is the venous return. In all local tissue, blood flow regulation is equal to the venous return. So, in short, I am going to say that cardiac output is equal to the venous return. Tissue metabolism regulate most blood flow, and definitely when the metabolism is high, there is more utilization of the oxygen and more utilization of nutrients in that tissue. So it is necessary to control the blood flow in that region. Venous return is equal to the sum of blood flow from all the local tissue. When the tissue metabolism is increases, blood flow in that tissue increases. Tissue oxygen consumption is increased, then the blood flow in that tissue increased. This is the formula how you can calculate the cardiac output. Arterial pressure is divided by total peripheral resistance. This is the cardiac output. Okay, now I'm going to submit this topic. Cardiac output is determined by the sum of all the uh, various factors throughout the body that control the local blood flow. All the local blood flows made to form the venous return, and the heart automatically pumps this returning blood back into the arteries to flow around the system again. Next topic is the heart has the limit for the cardiac output. Although heart do not directly control the cardiac output, the primary factor is the venous return. But when a cardiac output exceeds from a normal, heart become the limiting factor, and it is explained quantitatively in the form of cardiac output curves. This is the curve I'm going to show here. I'm going to show you here. Okay, see. At x-axis, I took the right atrium pressure, and the unit is millimeter of the mercury, and at y-axis I took the cardiac output, and the unit is the liter per minute. All right. In the previous topic, I told you that in a normal adult human, cardiac output is 5 liter per minute. This is the normal cardiac output of an adult. But here you can see that the normal cardiac output is approximately, sorry, there is a mistake in a curve. इसको यहाँ पे सीधा होना चाहिए था. Normal cardiac output of a human is 13 liter per minute. यानी कि एक एवरेज अगर आप देखें तो 5 लीटर पर मिनट है, लेकिन अगर 13 तक जाती है तो भी आप उसे नॉर्मल कंसीडर करेंगे. ठीक है। अगर 13 लीटर पर मिनट जाती है तो भी आप उसे नॉर्मल कंसीडर करेंगे। इसमें डिफरेंट फैक्टर्स आ जाते हैं, उन फैक्टर्स को हम नेक्स्ट स्टडी करते हैं। अच्छा, नाउ यू कैन सी दैट cardiac output is the 10 liter per minute और the cardiac output is the 5 liter per minute। ग्राफ के अंदर ये थोड़ा सा ग्राफ अप हो गए, इनको यहाँ पे आना चाहिए था और इसको यहाँ पे। दिस इज द हाइपो इफेक्टिव। हाइपो का मतलब होता है लेस, यानी यहाँ पे ब्लड नॉर्मल से लेस है, लेकिन इस पर भी प्रॉब्लम बॉडी के अंदर कोई क्रिएट नहीं होती। प्रॉब्लम यहाँ पे आती है जब कार्डियक आउटपुट 0 से या 1 to 3 हो जाता है, ये डेंजर जोन आ जाती है। ठीक है, अब यहाँ पे आप बकाया अगर ग्राफ देखें तो यहाँ पे जो कार्डियक आउटपुट है वो 13 से नॉर्मल से अबव जा रहा है, दैट इज़ द हाइपर इफेक्टिव। इस पे हार्ट जो है वो नॉर्मल से ज़्यादा बेटर काम कर रहा है। आई होप कि आपको ये ग्राफ एक्सप्लेन समझ आ गया होगा। Next topic is the factors that cause a hyper-effective heart rate. Two types of factors are involved and that make the heart a better pump. First one is the nervous stimulation, second one is the hypertrophy. In nervous excitation, increased in the sympathetic stimulation and parasympathetic inhibition, it causes the hyper effect of heart. Next is the hypertrophy. Hypertrophy is the increase in the size of the muscle. When the workload increases in long term, it causes the increase in size plus contractile strength. It doesn't mean ये वो लेवल नहीं है या वो रेंज नहीं है जिसमें हार्ट टिश्यू डैमेज होना शुरू हो जाता है। ठीक है, आप हार्ट नॉर्मली अगर हार्ट रेट ज़्यादा रहता है तो स्ट्रेंथ भी इंक्रीज हो जाएगी प्लस मसल साइज भी इंक्रीज हो जाएगा। अगर आप ये नॉर्मली मैराथन रनर्स वगैरह को देखते हैं तो उनका जो एक मैस है वो 50 to 75% इंक्रीज हो जाता है, और इसी तरह उनका कार्डियक आउटपुट नॉर्मली 60 to 100% इंक्रीज होता है। जब अब आप कंबाइन करेंगे नर्वस स्टिमुलेशन को हाइपरट्रॉफी के साथ तो हार्ट पंपिंग अप्रॉक्सीमेटली 30 to 40 लीटर पर मिनट हो जाएगी। मैराथन रनर्स या ऐसे लोग जिनके अंदर बॉडी एक्टिविटी ज़्यादा होती है उनमें ये आपको मोस्टली नज़र आएगा। उसके बाद है हाइपो इफेक्टिव हार्ट। Increased arterial pressure causes hypoeffective heart. Inhibition of nervous stimulation, pathological conditions, various infections in the body. Coronary artery blockage. Coronary artery is providing blood to the heart tissue, and if the heart tissue is deficient of the oxygen, its ability to contract blood or uh, uh, its ability to provide blood to aorta decreases. Congenital heart diseases. This is the heart disease, um, or you can say defect in the heart structure present at the birth. We use the word congenital for the defect which is from birth. Myocarditis, inflammation of the heart tissue, and the cardiac hypoxia. Word hypoxia is used for the deficiency in oxygen. Next is the role of nervous system in controlling cardiac output. I will explain you this with the help of a graph. Okay. Actually, this graph is the result of an experiment that was done on a dog administered with the drug dinitrophenol. Dinitrophenol increases the metabolism in all body tissues, and this increases the dilation of the blood vessel. When the metabolism increases, definitely nutrient usage and oxygen uses of cells or tissues increases. Then vessels are dilated to meet the need of the tissues. All right. Then they when then at x-axis time is taken and it is in minutes, At y-axis cardiac output, and the unit of cardiac output is the liter per minute. Okay. When there is a nervous control, as um, when the nervous control or autonomic control is working, here you can see that arterial pressure is normal. uh, Although vessels are dilated, but the arterial pressure is normal. Or you, in other words, you can say that autonomic nervous system prevents the following of arterial pressure from the normal. This solid line shows the working of the autonomic nervous system, and this dotted line shows the working of and this dotted line shows the arterial pressure without the working of the autonomic nervous system. If this nervous system do not work, then you can see a sharp decline in the arterial blood pressure. In the next graph, you can you here you can see a sharp decrease in the cardiac output. And here in this graph you can see when the nervous system is working, arterial pressure is normal, but when it is not working, there is a sharp decrease in the curve. Okay, next is the effect of the nervous system to increase arterial pressure during exercise. During the strenuous activity, metabolism is increased, and this increased metabolism causes the arterioles of muscles to relax. And when this relaxation occur, cells and tissues are provided with more oxygen and the nutrients. Then are definitely due to dilation of vessels, total peripheral resistance decreases. And when it decreases resistance, total arterial pressure decreases. However, nervous system immediately compensate the decrease in the arterial pressure. A brain sends the motor signals toward the muscle, and it active muscles then now sends back signal to the autonomic nervous system. It and the circulatory activity excitation center increases its activity, and a contraction of large veins occur. When the contraction occur, heart rate increases, and the more blood is flow occur in the active muscle. That is the completion of the topic. Thank you.